Hello, I'm Dr. Brandt Gibosn, and today I want to talk to you about chronic inflammatory demyelinating polyneuropathy, CIDP. Now, CIDP, or chronic inflammatory demyelinating polyneuropathy, is a neurological disorder similar to Guillain-Barré syndrome, except it's actually an inflammatory, a chronic inflammatory condition where what happens is, due to inflammation, you're getting inflammation of the nerve or the nerve roots, and you're actually creating a peripheral neuropathy symptoms from damaging the nerves, whether it's damaging the myelin sheath, the lining of the nerves, or it's damaging the nerves directly themselves. It's a pretty significant problem and usually presents with numbness and pain. Although every individual with CIDP have different symptoms and different problems, it can be pretty problematic and needs to be handled and treated in some way. Because it's a chronic disease, because it's considered a chronic disease, having the symptoms that are consistent with CIDP for less than 8 weeks is not considered chronic inflammatory demyelinating polyneuropathy. So it needs to be going on for a longer period of time than, say, just 3-4 weeks. It needs to be over 8 weeks. Most people do require treatment. Most of the time it's going to take a long-term treatment situation, and as opposed to Guillain-Barré syndrome that presents really quickly and when treated can be resolved relatively quickly as well. A lot of times this is much harder to treat, much harder to diagnose. In fact, there's not any tests you can do that say, okay, this is CIDP. So how does it present? As with Guillain-Barré, it's more common in men than women, but it has been found to be in somewhere around 40,000 individuals in the United States have this condition. What causes it? Really, they don't know. They know it's an inflammation, but they don't usually link it to any disease processes. It's not linked to any infections or anything like that. It's just inflammation of the nerves and nerve roots, like we said, that causes damage to the nerve and often pretty significant damage to the myelin sheath. And that's the reason that you're going to have weakness and pain and fatigue and numbness, because with the damaging of the nerves and the nerve root, you're going to get the signals to slow down, or you're going to get weaker signals to the muscles, weaker signals, sensory signals, and so forth. And so it doesn't work quite as well. There is a rare situation where Guillain-Barré syndrome can progress when it becomes chronic to CIDP, but otherwise they're not really linked. They're two distinct disease processes, and so forth. So not easy to diagnose. It's usually diagnosed through physical examination, and they rule out some of the other possibilities before they say, oh yeah, this is CIDP. So how's it treated? So if you've got CIDP, what are the things you can do to treat it? One, corticosteroids do help. As you decrease the inflammation, you slow down the immune system, and in so doing, slow down the damage and the progression of CIDP. IVIG, so the intravenous immunoglobulin, like with Guillain-Barré syndrome, is also a treatment that can be used for this, as well as plasma exchange, other immunotherapy, because this is an autoimmune type disease, and even stem cell transplant has been used in some cases. The big thing that a lot of times we'll do, because one of the disabling portions of CIDP is weakness, and so a lot of times physical therapy and exercise is a key to helping treat this particular presentation of peripheral neuropathy. As with other peripheral neuropathies, it's been shown to improve the motor component or the motor neuropathy component of this peripheral neuropathy, and can help significantly. So if you have found that you're getting progressive weakness and you're getting some discomfort and pain and numbness and tingling, and it's progressing and it's getting worse and it's been going on longer than 8 weeks, one of the things we want to look at, if we can't determine it's peripheral neuropathy from other causes, of CIDP, because the sooner you treat it, the earlier you treat it, the easier it is to resolve the symptoms or resolve the problems and so forth. So this is Dr. Brandt Gibosn, and this is your Neuropathy Nugget, day 96, CIDP, chronic inflammatory demyelinating polyneuropathy. And it is a genetic disease. We don't know the true cause, although it is a chronic inflammatory disease that has to be present for more than 8 weeks to get that diagnosis, and usually has to be treated by immunotherapy. Again, this is Dr. Brandt Gibosn. Have a great night.